going to do Foley catheter insertion, and for that we need a kit. And in the kit, it's almost everything you're going to need. I have extra pair of clean gloves, and some soap, body soap. This has warm water. It doesn't really, but I would have warm water, and I have a towel already in there, and 2 dry towels, because I might have to do it after. So I'll show you that whenever I need that. So yeah, everything you need is in the kit. You would walk in. You would perform hand hygiene, knock on the door, introduce yourself. You would take name identification. Hi, Mrs. Smith, Maria Smith, and date of birth, blah, blah, blah. Can you tell me your name and date of birth? So 2 identifications. Okay, you explain the procedure. You have an order. You have to make sure that they have an order for a Foley catheter insertion. They probably already had like an ultrasound to see that they had too much urine volume in their bladder. So just make sure that they do have an order, and you explain that they have an order, and you're gonna insert a Foley, and it might be uncomfortable, but we're gonna try to make it as uncomfortable as possible, and we're gonna be here the whole time. So we would do an assessment, and the assessment, you can wear gloves. You have clean hands, but I'll wear some gloves. So the bed seems to be elevated already, but let me check. I would provide for privacy by closing the curtain. Let me see. Yeah, this looks high, but that's for this bed, that's the lowest position. But if I was a little uncomfortable, I would check their abdomen. Okay, I'm going to check your abdomen, and then their bladder mostly. So, it's a little bit distended, so I would check for distension. I would see if there's any odd color. I might do a GI assessment as well. But we're mostly concentrated on their bladder, and we ask them questions like, when did you last urinate? Oh, I've had trouble urinating. Okay, we're gonna take care of that with the urinary catheter. And yeah, so you can get started. I'm gonna just set up my station. Just bring my table over and lift it up a little bit. Oh, the other way. The legs are on the other side. Okay, let me lower your bed to get the table in here, okay? Okay. Sorry, you have to get your positioning well. Okay, and I need to check your private part, your vagina, just to make sure it's clean. To make sure it's clean.
10 minutes. Make sure you clean up.
Okay, thank you. So I uncover this, and then I made sure I had some warm water. If they, it's nice if they have an absorbent pad underneath. If not, you could place a towel. So I have warm water. I already placed some soap. So I just wipe from front to down, and then you can use another area of the towel. Okay, so it's clean, and you would put this in the dirty laundry. So I don't have one. Okay, so it's clean, and now I'm gonna open my kit up, and I can open it here. I'm gonna make a sterile field around here, so I'm just gonna open it near the patient. So it tells you what you have here. This could be your trash bag. Okay, so you open this. Okay, and I'm gonna ask her to get into a butterfly position. Okay, could you please fold your knees? And then just put your ankles towards yourself, okay? So she'll do that. I have to assist because it's a mannequin. But yeah, she has to be in this position. There you go. So separate your knees a little bit, and yeah, so I think that's pretty good. So you get the kit, and you could open it here. I'm opening it kind of where I have some room here to work with. So open it outward, like away from you. See, that's good. Those are my sterile gloves. So I need those, and I'm gonna put them on the table. I'm gonna put them on here because that's where I'm gonna open them up and put them. Okay, so here is your sterile sheet that you're going to put underneath the patient, the blue side goes down. We want the shiny side down and the absorbent side up. So you're going to put it on them. Okay, and now I'm going to put my sterile gloves on. So that area was already cleaned, and I'm going to put my sterile gloves. I just want to make sure that I just touch the outer border. So I'm touching the outer border here. We're good. And I'm going to touch, for the first glove, this part inside. Only the inside part. Don't touch the outside. Okay, now that I have this one on, I'm actually going to help with this one by putting my fingers inside the glove and then working my hand into there. And I could throw this away. The inside's sterile, so I can throw it away if I had a trash can. But I don't, so I'll just leave it there. So my hands are sterile, and I could touch my sterile items. The package comes with a drape here, and it's meant for it to go like this. But the shiny side down. So this shiny side would go on the other side, like this. But it's a little inconvenient to use this because you can't get the sides as well. So I'm gonna discard this. I was just showing you how it works, but I wouldn't use this. So I'm still sterile because let's say I just threw it away, and I'm seeing that I have iodine, I have lube, my syringe. I could put this tray here. I could put it here, and then I have my bag. This is a specimen collection cup, and this comes already pre-wrapped. And what I want to do is prep my kit here, so I can open these up. Well, no, I can't. I wouldn't be able to use them, but yeah, the tips are here, so you can just open the top, and the wooden sticks will be out. So when you're cleaning, you can just remove it with the wooden sticks. The lube you can open and press it in the tray here. And then this, so I'll prep this. So this, I'm gonna take out and put it in my lube. See, it's sitting there in my lube. I already put some lube in there. And this could go in the trash there. And I'll put this here. This is where it goes. This to inflate the balloon. So take off the rubber tip. There you go. I don't want to put extra air, but it's okay if there's some. Oh, it's okay. Sometimes things happen. Okay, so we'll have a little smaller balloon. Yeah, there's still enough fluid here in the syringe too. So just make sure it's screwed on good. And yeah, we're ready to insert. We've already had it in the lube, and we're gonna clean it. So we've had these open. So we would take one, and now I'm gonna make my dominant hand sterile, and I'm gonna open up, separate the labia with my non-dominant hand, which was my left. So you would, okay, now I'm just gonna clean, and I'm gonna put with some cotton swabs, okay? Are you allergic to any shellfish or iodine? No, I'm not. And of course, that's something you would want to check before you even start the procedure, because these are iodine. And yeah, so you check that, and then if she's not allergic, then you would get one cotton swab, and you will out. So and out, throw away, and then so that was right, and now the left side, throw away, and the last one would go for the inside, so the middle. So it would be left, right, and then middle, and then you throw that away. Okay, now I'm ready to insert, and my hand is still sterile. I have it in my lube already. Okay, so I have my syringe attached, and now I can insert. Okay. And you insert it until you see urine flowing. If they complain, yeah, so you insert it, and then urine is flowing, and you insert it 1 to 2 inches more. Okay, so urine is already flowing. I inserted about 1 to 2 inches more. Okay, so now I'm ready to inflate the balloon. And if I inflate it, I'm gonna start inflating it now. I still have it in place with my fingers there. Because if I were to take out my fingers, the balloon isn't inflated yet. So I would inflate it. And if they complain of pain, you should stop, because you might be in the wrong location. So you inflate the balloon, and you could take this off, and then you do a little tug, and then yeah, it'll stay. Like, okay, it's in place. So from there, you can tape this side here. You can, well, actually, that's one thing I forgot. So you can, for now, there's attachment devices, but for now you can press the tape, put the tube on the tape, and then put another tape on top of it. So that would make it in place. You no longer have to worry about sterility because it's already inside. So these would be all trash. And if we had a trash can in the bottom here, we would throw it away. Okay, and then we could press this on top, underneath their legs. So this would be trash. That's our trash. And we could throw this away. If we need to collect a specimen, we have a specimen cup, and this is sterile, so we could collect it right out of the bag. But the doctor didn't need that. So underneath here, and it would be attached. So let's say it's attached there. I'll clip this on but it would be taped down. So the bag here has two cloths, and we would attach it to a non-moving object on the bed. So it wouldn't be the rail. It would be something like a hook underneath the bed. Something you could attach. And then if there's any loops, you want them to be with higher pressure, so from up to down, not I don't know, there's like a separate way. You want it to flow from high to low. See, this is wrong because it's going down, and then it would have to come up, and it would be more difficult for that to happen. So this is okay, from high and then down, and it would drain into the bag. And then yeah, you would provide, okay, thank you very much, and how are you feeling? You can do an assessment. Oh, it's draining, it's much better. Okay, and you just make sure your patient's comfortable, privacy, and I believe you're done from there. Yeah, you're okay.